And welcome everyone. Today, as you heard, I'm going to talk about the advertising and promotional material compliance and review process. Now, just in advance, I will say there's a lot of material to cover here. I will get through it as quickly as I can, but I'll definitely make sure that there's time for questions at the end. So if I haven't quite touched on what it is that you want to know about, feel free to ask, or the slides are all going to be here so that you can look at them and follow up with us later if you have any further questions past what I present. So what I'll focus on is beginning with the current environment. There is increased concern about drug safety, and so there's a lot of focus on misleading patients and things like that, as you'll see when I go through the presentation, and making sure that all of the safety information is communicated in a way that consumers can understand or that physicians can relay the information. There's also a lot of activity in the area of post-marketing safety monitoring systems, making sure that adverse events are captured if they occur with a patient. Concern always going on about drug pricing, and in this case too, there are a lot of states who are involved. So not only do we have the federal things we need to think about now, but there's also a lot of state requirements for reporting about payments to doctors, for example, who might go around and speak on your behalf as a company, and just getting the price of drugs down for consumers. There's a huge focus on that. And what they look at a lot is how you're advertising things. And states will also come and criticize in addition to the federal government. So it's just broader and broader regulatory requirements that need to be met. So there are whole departments and companies that have to do this kind of thing. And then, of course, in the US, unlike any other country in the world, we're able to advertise directly to consumers. So there's been a huge impact. Because of that huge impact, there's been a huge importance put on this. So there's a whole group at the FDA, of course, that deals with the direct-to-consumer advertising that you might be doing. So let's look at good promotional practices then in the US. What it's really all about is ethical and compliant business practices in how we market and promote the drugs and or devices. It's required that all employees, all management, any contractors or any vendors that work for the company all abide by the same set of rules and regulations. And many times they don't understand that. And that includes anyone who you hire to be a speaker on your behalf. They're a consultant for the company, and therefore they have to abide by the same rules, or they could get in trouble, or the company will get in trouble. It allows us to work in a compliant way and to still be successful, because everyone will be held to that same bar of understanding. It's very important that companies adhere to that, because there are many examples where when a company or even certain sales reps did not adhere to that, someone is paying steep fines. And in a lot of cases, if you're covered by Medicare or Medicaid or one of the federal programs, they can revoke the complete coverage because the company was practicing non-compliant behaviors. So there are huge consequences if the company doesn't do this. So there need to be a lot of programs to train employees about that. Now, in the case of whether you're talking to a physician, the term is broader than that. It's the healthcare provider. And it really includes anyone who practices or is authorized to prescribe, anyone who is comprised, any company who is comprised of healthcare professionals, the hospitals, the nursing homes, the pharmacists, and health benefit plan administrators, so payers or formulary companies. So anyone who's involved in that drug business would be expected to have the scientific knowledge to receive messages for a professional. And then everyone else is a consumer. Anyone who acts on behalf of the company, this can't be reiterated enough because it's the one thing that a lot of times people don't understand. They must meet the same burden of requirements as anyone who's working in the company itself, even if it's different than the company policies.